Yet parents are smoking tobacco in their own household, forgetting that they're having these young people there and they're the role model. A young person sees a parent as the role model there. If my parent is taking alcohol at home and I'm there, I'll automatically take alcohol. I don't see a problem with it because my parent is taking it. Yeah. So we start also sensitizing the parents on those issues.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen, and I'll be your host. Let's roll.
Greetings and welcome to the African NCD Champions podcast, a podcast where we meet and talk with incredible people working in the non-communicable diseases space across Africa, bringing change to communities and societies where they live in. As we know, non-communicable diseases are the leading killer diseases globally, accounting for 3 out of every 4 deaths. And its risk factors, including alcohol use, tobacco use, unhealthy diet, sedentary living, and air pollution, are prevalent in societies, especially in developing worlds. In Kenya, the Young Health Program, a program being run by Plan International Kenya and being funded by AstraZeneca, works to ensure that non-communicable diseases and their risk factors are addressed in their communities, ensuring that young people grow better, healthier, and more prepared for the societies to come. And now we'll be talking about a very interesting story right from the communities where the Young Health Program has been implemented. Before we go into more details, I'd like to introduce my guest and give us a quick introduction to yourself and how we got to be here today.
Okay, I'm happy to be here today. My name is Magdaline Anguche, a peer educator and a Young Health Program, and also a youth advocate and a Young Health Program. Mm-hmm. Yes.
Yeah, so briefly, talk to us about what your work has been in the community under the Young Health Program before we start to go into some more details of the work you've been doing there.
Okay, so as a peer educator, my work is to make sure that young people have improved knowledge on NCDs or non-communicable diseases risk factors and make sure that they get better information about it. And as also a youth advocate, I make sure that we follow up with the policies that affect young people on matter of NCDs. So that's what I do. Basically, we do community sessions and also school sessions and also to sensitize the health facilities. So in school session, we make sure we have a health club that is running, comprises of young people that around 35 per health club, whereby we talk about the risk factors that are affecting them. And through that, we've had so many successes. For instance, we worked on a school healthy policy of 2018, whereby it's being implemented in school. This is to make sure that teachers are involving the young people on matters of NCD, by including their work plan or schemes of work with the NCD information so that these young people can get in school, putting in mind that the young people are spending much time in school than at home. So also through that, we also make sure that other interventions that we come with is we found out that the young people are not getting healthy diet at home, basically due to economic frustration from the parents. But through these school health club interventions, one school recognized our work and decided to start giving the young people healthy diet that he partnered with a donor from China. And through that initiative, like other 16 schools have been getting this diet. At least we can say at least 10 or 20% of the young people in schools are getting healthy diet from the school level. And now for the community level, we are working together with the CHPs, community health promoters. We're also working with the government, the chiefs. We're also working with the leaders to make sure that the young people, they are creating a safe space for the young people in the community, and to make sure they're also guided in a way that they can prevent the NCD's risk factors. So through that, we sensitize the CHP because they are allocated 100 households. So through their rounds, they can also share the information on NCD. It reach from the people from their own household. So through the chiefs or they reach them through the barazas. When they're having barazas, at least one of us goes there and shares the information about NCDs, and that includes also the Limbakumi, whereby we are having our community leaders from. And also that we also have parent sessions whereby you see when you're giving the young people information, at the end of the day they're going back to their homes, and their parents are the sole decision makers. So we also sensitize the parents. We have a parent session whereby they also give them their views of the young people, and we sensitize them on healthy diet, even on air pollution, especially on tobacco. You get parents are smoking tobacco in their own household, forgetting that they're having these young people there, and they're the role model. A young person sees a parent as the role model there. If my parent is taking alcohol at home and I'm there, I automatically take alcohol. I don't see a problem with it because my parent is taking it. So we start also sensitizing the parents on those issues. And also the teachers. We also have sessions with the teachers whereby we take them through the risk factors of NCD, because also spend a lot of time with the kids. So also tell them to sensitize the pupils, especially on the physical inactivity. You find out that most of schools are not obeying the PE class.
Yes.
That's the time where a math teacher wants to make sure
that people are doing math. The syllabus of math is covered.
Yes, that's where the English teacher will remember. He has not done this and this. Now you see the PE class that was set aside for physical activity, it's now taken over. So also sensitize the teachers why it's important for this young person also to have the physical exercise, and it is working. Like PE class is, and with the CBC it has improved because the physical activity is part of the CBC curriculum, and that's amazing.
Yeah, that's a very, very lovely introduction and really going into what you've been doing with your work in the community. Tell us a little bit about something called youth-friendly services, where you've really been a champion of the youth-friendly services and the scorecarding. So give us more information about what you've done around ensuring that young people in the slum areas of Mathare are having access to youth-friendly services, and also give us some more information on scorecarding and how you are able to do that in the communities.
Okay, so before we reach the scorecarding of the youth-friendly service, under Young Health Program of Plan International, we are working with 4 objectives. So the first one I started with, we share information. As we educators, we make sure we share information with our young people to make sure they're aware of the information, their knowledge has increased. So from there, so this a young person who has improved knowledge, where does he go to the community? Yes. Now from the community, that's where we sensitize parents, teachers, CHPs, and everyone. So from the community, he's aware I can go for screening, I can do checkups. Where is he going? To the health facility now. So number 2 is we create a supportive environment for our young people through sensitizing our parents. And now number 3 is now there where you are youth-friendly service. We make sure that our health facilities are youth-friendly as possible and gender responsive. So why we do this? Just to make sure that uptake of health services with the young people has increased, and make sure they are also accommodated and their needs are met as they want. So through this, how we've achieved the scorecarding to make sure that our young people are accessing it, we have done so many interventions. The first one, we worked with Nairobi City County to develop on-site orientation material, whereby everyone is sensitized. We start with the watchman, we go to the cleaners, everyone in that health, but even to the in charge is also sensitized, very sensitized on why it's important to make sure that we have youth-friendly service at the facility. So we developed that manual with Nairobi City County, and it has been launched and it is working, and we can see now our health facilities are youth-friendly and young people are so comfortable to go there. And how can we keep our health facility to be so youth-friendly? So we also worked with the Nairobi City County to come up with the costed implementation plan. This one is just making sure that our health facility also allocated some funds. We are advocating for it to make sure that our health facility have funds for NCD department. You see, every time when they're doing budget, the NCD department
suffers the most.
A lot. You get the NCD department has budget, but you get it is being used for another thing. Yes, so we advocated to make sure that funds are there to make sure that we are sustaining this youth-friendly service. Of course, the doctor will tell you the young person is coming. Here we have a lot of family planning. Maybe depo is not working for me. I want an implant. The facility does not have. What happens? So you see now we go back to zero. So that's why we are advocating on that to make sure that our young people, their budget is there in the health facility, and you don't have to go to the facility far away from you. So even the level 4 facilities, we make sure they're having these resources on screening NCDs, on refer everywhere, that a young person can get it from there. So
and that is interesting, because on the facility side and on the youth-friendly side, there's the issue of privacy.
Yes.
Because when I used to be a peer educator working in the communities, if someone went to the hospital and asked for a certain type of contraceptive, before they got home, the whole community will have known, oh, he came to the hospital asking for this implant, and that really discouraged people from going into these health services. But now you have been working under the youth-friendly services framework to ensure that this privacy is being upheld. Could you talk a little bit more about that side of things as well?
Okay, so through scorecarding, that was an issue that was raised on confidentiality and stigma. Yes, young people came up strongly. They say it's not a problem going to this facility, but now the problem is you've gone for a certain service, especially on sexual reproductive health and rights, and now you're going back home. Everyone knows wherever you went to the facility to get. So, and that's when we covered it through all-site orientation, whereby even CHPs are being involved. They're also trained on that. Why is it important to keep confidentiality? Yes, and also communication and matters of attitude. Yeah, I've come there as a young person. I need this service. Can you accord me with the same respect? I also accord you with the same respect. So it's two-way. Yes, so we've sensitized the health facility to make sure that there is no breach of confidentiality, there is no stigma, and also there's also inclusion of people living with disability. You know, that's also another aspect that's always left aside. You see, there is this facility, there is no pathway for the people living with disability, or how can they be accommodated? We also capture that in that whole-site orientation, whereby everyone is an inclusion, everyone is accommodated. It doesn't, and nothing can define you. Everyone deserves to get the right service, the right information to what or he wants. Yes, that's why we are saying it should be gender responsive.
Okay. So, talk to us about some of the successes, some of the impact, some of the challenges that the youth-friendly services and the scorecarding has had, and how you've been able to navigate that, especially for young people.
I'll start with the challenge. The biggest challenge was convincing the young people that our facilities are now as youth-friendly as possible, because they had already get used to counter medicine, counter of medicine, that you just go to a chemist, that's self-medication. Or Mr. Google is also there. Yes, I'm feeling like having stomach ache or what, you go Google, this is what I'm feeling, they give you name of the medicine, you just go and buy without even preparing. Yeah? So young people already got used to that because the health facility were not a safe space for them. Now the biggest challenge was just convincing them, but how we've done it, we've organized a lot of outreaches in our community to make sure that these young people are getting the right information. So we've done outreaches, we have been marking calendar days under WHO to make sure these services are coming to the young people from the community. When they see these services are there and some are free, they go, they say, oh, so we had even a feedback meeting with healthcare providers in charge. They were giving us the progress. You see now, since we did the scorecarding, we did midterm evaluation and end-term evaluation, now we can ascertain that young people are now accessing these facilities. They have improved in terms of IC material, in terms of their standard chartered, the services they're offering is there. If you pass, you see this, we have mental health talks, when can you come as a young person. It's now, that's some of the major success we've had. And also to mention on the schools, we are having diet, which is very, very, very amazing. And also for the community leaders, at least we've changed the narrative whereby most of the program, by the way, when they come to Mathare, they're girls. But now this is another program that came that is inclusive, regardless of the gender. So now at least we are feeling that the boy child is included. Now we change the narrative. We are working with men. At least now the community is not stigmatizing the boy child that, oh, these are thieves, these are drug dealers. You know, that aspect that boy child is just bad. Now at least they're saying the boy child is coming, sharing information. There are also some of our peer educators who are men and taking these places, even when they're organizing for a cleanup, boys are coming out from the CBOs, they come and partner with us. We do a nice cleanup, or we do sensitization on health days. So those are some of our successes. And also I as a person is a success because just sitting here is a success. So you can never imagine we didn't even imagine that there's something good that can come out of Mathare. You can see Mathare has been pictured as a drug place, insecurity place, and somewhere that no one, not a normal person can live there, but you can see it's a different story. So we can still tell them that Mathare is also a nice place. And also with young people with lots of potential, and we can do anything to better our community. Yes.
So before I come to ask you some of your recommendations and ways forward, what did you say, especially with the work that you've already done, what did you say that the role has been for, first for the students, what has their role been? And then what has the role of the peer educators been? What has the role of the teachers been? And then also what has the role of parents been in ensuring that the whole community is involved, they understand their health, and that they are able to work together to improve the health of their communities and environments.
So I can start with the role of a peer educator because I'm one of them.
Yes, that will be our role.
Yes. Our main role as our own objectives to make sure that our community have the right information. And I can assure you our peer educators have done a massive job to make sure that these young people are getting this information. So for us, and you are like the role model in the community. So if you are a role model, you should live accordingly. So I think we delivered us as peer educators, for the teachers, for giving us that even time to talk to the young people. Not them doing math. You know, we do sessions once a week for schools. So being given that time and also making sure that giving these young people opportunity to also learn extra curriculum activities has been amazing, and we appreciate that so much. And also the role of our parents I had forgotten one of the success that is very, very amazing when I talked about the parents. There was these two parents, I think from Mlango Kubwa, Mathare. They used to smoke. And now there's this young person who was in our school health club learning the effects of tobacco. You know, tobacco is either direct or indirect. So you don't have to smoke directly to be affected. There is also the indirect. So now this young man, it's a young boy, He was so asking so many questions about this. Does it mean even me can be affected? Do you know my parents smoke? But we didn't tell him to go and have that discussion with the parent, but he took it upon himself to go and talk to the dad. And tell him this is the effects of tobacco, and insisted until the dad himself came to our session and said, my son made me to stop taking tobacco. So that was a very big success. And the son insisted and even we use also pictorials. We print out pictures on the effects of tobacco, so we share with the students. Even took the pictures, shared with the parents. This is what is going to happen to your lungs. You are going to die. And you are going to make me die. My lungs also become like, because I'm inhaling in your smoke. So he was so persistent until the parents changed the way he lived. At least now he's not smoking in the house. Yes, so the role of a parent for also supporting when they're being called for the meetings, for the sessions, also share their own experience and also share with them what their kids are thinking about them, and to integrate, at least to come up, at least homes should be also a safe space for the kids, and also to make sure they support them in any project that we work with a lot of projects with schools. So even the parents supporting them is so good. Which one did I forget?
Teachers.
Teachers, I said, support, giving us the time to have with the kids, putting in mind the CBC curriculum is so heavy in time. So giving us that 1 hour a week is very important, which I appreciate. And also for them sitting in those classes, every day is a learning day. Yes, for them sitting there, even asking questions, sharing with us their own experiences, it's cool.
I see. So, last question is, what are the recommendations that you have and ways forward to projects like this, to funders of the project, and even to the general community? What would some of your recommendations be?
Always involve young people. Yes, always involve young people. Young people are capable of doing anything. Yes, as long as you give them the opportunity, they'll show how they can do it. I was given one and I did. I know I did my best. Yes, it's high time we pull all the seats to the table. We start having this conversation with the young people. Yes, we should not stigmatize young people. I know there's a lot of stories going on around the Gen Zs or what. Let's just put that aside. Young people belong here and you are the future. So bring young people on the table. We are coming up with a project. Involve young people. Ask them, what do they want? You can't give somebody something that they don't want. Yes. So ask them. Do a research. Is this beneficial for these young people? And if young people are on the program, it will move. Young Health program has never had problems with the young people because young people own the program. And in fact, Plan International let us lead this program. Yeah, everywhere. I sit with Nairobi City County. I've worked with these hotels. I've even attended a reproductive health network in Kwale. Tell me why they would send their own staffs. They always send young people there because that's our space. So if they do what Plan International has been doing, including young people in decision making, everything, that's our way, everything will be okay. I recommend that. Continue involving young people, and you will have the best future that you want. Yes.
Yeah, I see. So one last question, and this is a question looking at just the overall impact, and the question is, what's your, if you summarize the whole project, what did you say the biggest impact has been? And we'll close with that.
Since I love health, I would say the biggest impact just making sure that our health facilities are responsive to us. Yes. I know if Young Health program will not be here today, young people will still go to those hospitals and get the best care they want. And also for organizing the outreaches. We do even door-to-door sessions whereby we reach these people from their own household. So that's just a great, if he can't come or if she can't come to the session, we go there. So I can say it has been impactful because you see people practicing these things that we've been telling them. For instance, people used to cook with jikos in their own house inside. And you know, Madare, we do not have houses with windows. Just a house with a door. And now you're cooking your chapati and you close the door because no one neighbors to come in. So we also tell them, do you know the risk you're putting? And you have there a newborn baby. You see the risk that you are putting this baby into. Now at least today, if you go there, people are cooking outside. You can get a jiko outside, they are cooking and they have no problem with that. Yes, so at least they have started changing their lifestyle behaviors, activities, and it's okay. Even the cleanups. Before before the drainage system is full of dirt. But now if you go to Madare, people are putting the dirt they collect from the waste they collect from the house. So at a certain place, then it's being collected by young people. You know, that's a plus. We didn't have this cleanup groups. CBOs are coming out, they're doing plastic projects, they're doing recycling projects. So they collect the waste, they go disregard them, which one is good, which one is bad, and then they go and reuse it. And that's an economical part of it that now young people are earning from it. So we can say that one as a big thing. And they're coming up with so many projects like kitchen gardens. There's this school hunger had the kitchen garden. Unfortunately, when the floods came, it swept away everything. Yes. So projects are coming up, and I know young people are going to do best.
Yeah, thank you very much for sharing a lot of that experience. It's very nice to hear how the program led to more young people going to health facilities because they trust that the health facility understands them, respects their privacy, and is able to address their needs. And also the other interesting part is to know how through the Young Health Program, other programs, other community-led initiatives have cropped up to help with the other NCD issues, the health environment. And I think it's also very impressive to see how champions like you have been empowered and are now even working at the policy level to ensure that there is better health for the community. So with that, thank you very much for coming on board and for having this conversation with us. And we are looking forward to having you on the next one. Thank you very much and see you in the next one.
Thank you.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storelink and at NCD Champions. See you on the next one.